Well, hello. It's Bruce Williams again. It's a beautiful Saturday, the 2nd of May, here in Bethesda, Maryland. But unfortunately, because of COVID-19, we're still not going out today. Doesn't mean we can't have a little fun. Are you ready for Gross Bath Challenge number 72? Well, these things are starting to stack up, but I got lots of pictures left. So let's go for it. Slide number 1 is tissue from a dog, and we'll start with something that's fairly easy. Can you give me a morphologic diagnosis? Well, the time's up on this one. We're looking at the underside of the brain, and the first thing that I probably want to think about here is a pituitary carcinoma. There are other tumors that could pop up in this area of the hypothalamus, supracellular germ cell tumors, maybe craniopharyngioma, but I'm going with a carcinoma. Carcinomas can be tough to identify. Most people that know a lot about these generally go with size. Certainly if it's infiltrative and the surrounding areas, including sphenoid bones, maybe the piriform lobe or infiltrating up into the hypothalamus, that would be a good one. They're usually endocrinologically silent. They don't secrete anything. They may actually, as a result of destroying the normal pituitary, result in hypothyroidism because of a lack of TSH coming from this the pituitary, which has been destroyed. Maybe in long-standing cases, Addison's disease. I don't know if I've ever seen one like that. They can be difficult to look at histologically as well. If all you get is some slides of this, you may not be able to tell the difference between this and an adenoma. So it's sort of a size thing. Hi, Smeegs, how you doing? Want to say hi to everybody? Slide number 2 is tissue from an ox. Can you give me a morphologic diagnosis and 3 possible causes? You gonna drink my coffee? Okay, well, we're looking at the mammary gland, and it has been cut here so we can see 2 of the mammae or the teats, and there's a focally extensive, very well demarcated area of necrosis and hemorrhage affecting one of these quarters. This is a great picture for conditions that usually happen to cows during the summertime. They're in milk, they're being milked, and they're also living in a place with liquid poop. If you've ever been to a milking parlor or where they bed down dairy cows, there's always liquid poop. In the wintertime, we don't see these diseases as much because, at least outside, the poop is frozen. So when I keep talking about poop, obviously, I want you to think about coliform mastitis. It's a great picture of coliform mastitis bordering on gangrenous. Obviously, E. coli is in every environment, but this could be any of the coliform. So I'd have to include Pseudomonas, Proteus, Klebsiella, and maybe even some uncommon ones like Citrobacter and Serratia. Usually a lot of necrosis and hemorrhage, and this may proceed to sloughing out of the quarter. When we think about this particular lesion, it could also be Staphylococcus aureus. Remember, all of these bacteria will enter the mammary gland through the teat. Staphylococcus aureus is a common contaminant. It is on the hands of the people that work in the milking parlors, that attach the milking machines, or rarely will milk by hand, and that's why sanitation is so incredibly important. There are a couple of forms of Streptococcus that can do this as well. The lesion tends not to be as angry as it is with Staphylococcus. So if you want to pick 3 of those, Staph aureus, E. coli, obviously the 2 that I would think of, and then the 3rd one, well, just pick one. Let's say Klebsiella. There are a subset of diseases that cause mastitis that cause a indurated, firm, fibrotic mammary gland that doesn't look like this. It's sort of whitish. This is the ones like Mycoplasma bovis, Prototheca. They tend to happen in the winter. They take a lot longer to become evident, but you're not going to get this necrosis and hemorrhage. Slide number 3 is tissue from a dog. Can you give me, let's just name the condition. Okay, time's up. We're looking at a spleen. Spleen looks a little big, looks a little swollen to me. And what we're looking at are these sort of yellowish plaques on the surface of the capsule of the spleen. If you cut into the spleen, they will be right there on the surface. These are called cirrhotic plaques. I learned them as gamma antibodies. They are aggregates of fibrous connective tissue, iron, blood pigment, and calcium. They often are present within and expanding the capsule or within the splenic trabecula. And they are the result of trauma and hemorrhage, and then breakdown of those products. So when you break down the blood, you get hemosiderin granules, you will get calcium. There is dystrophic mineralization going on here, and fibrous connective tissue. You can get this from blood trauma to the spleen. I think most of them arise from the fact that the spleen is a dynamic organ. It swells and becomes congested, and then it shrinks down. And every time it swells or shrinks down, you have stretching of that capsule, you have a little hemorrhage in the periphery of the spleen, and so you get the formation of these cirrhotic plaques. I would not ascribe any type of diagnostic significance to them, and they are more common in older dogs. Sometimes you'll just see a rim right at the margin of the spleen of these cirrhotic plaques. Slide number 4 is tissue from an ox. Can you give me an etiologic diagnosis and the cause? Etiologic diagnosis is sort of shorthand. Instead of giving a full morphologic diagnosis, where we identify the process and the organ distribution, this one allows us just to quickly rattle off the organ and the agent. This is liver from an ox, and we can see these black tracts and then these large trematodes, which are living free and migrating through the hepatic parenchyma. Most hepatic trematodes like to live in the bile ducts. This particular one, Fascioloides magna, which is the largest of the lot, only uses the bile ducts for the females to lay eggs in, so they go out in the bile. The rest of the time, it traverses the parenchyma of the liver, and they are black in themselves, but they also leave a trail of black fluke pigment, which is their excreta. I like the term fluke pigment. Some people call it fluke exhaust, and that's fine, but it's black. These tracts have a combination of macrophages, which are full of this pigment, eosinophils, granulomatous inflammation, necrotic debris, and fibrosis. This is a parasite of all ruminants, everything from small sheep and goats, in which are usually fatal, they don't tolerate a lot of this, to cattle, to larger ungulates, and artiodactyls, like moose. The larger the animal, the more likely that it is to survive this. There's a couple of other things going on here. There are some areas of hepatic lipidosis scattered through here in the area of the trematodes. And a sick hepatocyte accumulates fat, especially if it is due to ischemic damage, oxygen starvation. We need oxygen to make ATP. ATP is important because hepatocytes can take in liver without expending any energy, but to repackage it and excrete it, to attach protein to it and re-excrete it into the blood, it takes energy. So sick hepatocytes tend to accumulate fat. They get big and swollen, but they don't release it. And in the areas of extensive trafficking by these parasites, you have ischemic damage, and the hepatocytes in these areas tend to become fat-laden. One other thing I do want to mention, there's a condition which is usually caused by trematodes called black disease. It's a combination of the migration of a different parasite, Fasciolohepatica, in the larval form through the hepatic parenchyma before it goes home to finish its life cycle in the bile ducts. And the migration of large numbers of Fasciola hepatica will cause ischemic conditions necessary for Clostridium novii to proliferate. You can get large areas of infarction in these livers, and that is known as black disease. Don't confuse the black pigment that you see with fasciolosis magna with black disease, which you get with Fasciola hepatica. Don't also forget that Clostridium novii has been identified in horses as a cause of hepatic infarction. And there has been a paper recently in VetPath, as I recall, where a number of cases, and I think this came out of Southern California, there have been a number of cases of Clostridium novii infection in the absence of Fasciola hepatica, but that's the classic trigger. Slide number 5 is tissue from a dog. Smee, you don't like all these dog slides. You want a cat slide, but sorry, you got to take what comes. Hey, can you give me a morphologic diagnosis and name the condition? Also name a breed. Okay, time's up. The morphologic diagnosis I'm looking for is diffuse mandibular, maxillary, and tympanic bulla periosteal new bone growth. If you want to say hyperostosis, that's fine. It's really, in this condition, hyperostosis and endostosis. This is a unique condition in which you get periosteal bone growth and endosteal bone growth as well, compromising the inside of the maxilla. Histologically, boy, it is really tough. Even if you take a normal section through the jaw, there's bone going all every which way and remodeling in all sorts of crazy ways. And I will take it that from very people who look at a lot of jaws, they can really, get turned around on badly taken sections because the bone just proliferates. And then when you get a disease like this, craniomandibular osteopathy, on top of that, it's just absolutely crazy. Okay, so this is obviously not a brachycephalic animal, it's a dolichocephalic animal, and this is most commonly seen in young terriers, West Highland Whites, Scotties, and Cairns, but it's also seen in a couple of other non-terrier breeds, like Great Danes. And the lesion develops prior to the closure of the phyces. So it's usually between 4 to 7 months of age. It is young animals. They become very painful. They have trouble, obviously, opening their jaws. You can see inflammation in there. You can also see atrophy of the associated muscles of mastication. Don't confuse this with a very different disease, atrophy the muscles of mastication, which does not have a bone lesion. You can see some proliferation of new bone in the periosteum, but just the periosteum of the jaw, especially the mandible, in dogs that are infected with Heterobilharzia americana. But it's usually just a little bit, and you can see the presence of that particular parasite within the periosteum and the muscles surrounding it. Slide number 6 is tissue from a chicken. Can you give me a morphologic diagnosis or name the condition? I'm happy with either. Okay, time's up. This is an interesting condition, which is known as a keratoacanthoma. And there are a lot of people that call them dermal squamous cell carcinomas. Histologically, they tend to look a lot of like. Now, if we look at it from a poultry processing perspective, if you have a single one of these in the skin of the animal, usually it's trimmed off and then the carcass is passed. If there are many of them or they are coalescing, then the carcass is often condemned, and it's called a squamous cell carcinoma. Now, what makes a keratoacanthoma different from squamous cell carcinoma? Well, in general, the keratoacanthomas arise from the epithelium of the feather follicle, whereas true squamous cell carcinomas will arise just from the regular epithelium. Now, you often will see hyperplasia of surrounding feather follicles. They may also undergo the same histologic changes. It looks very much like squamous cell carcinoma. You have hyperplastic epithelium, then you'll have foci of invasive keratinizing epithelium, but it is restricted to the dermis. They do not metastasize. It's pretty interesting that the animals are able to develop all this in the 8.5 weeks it takes to get to market. So if there are multiple ones, usually it's condemned, and they just say squamous cell carcinoma, boom. But one of these can be trimmed off. But they're always associated with the feather tracts. So keratoacanthoma. Keratoacanthoma is a term that's used for a wide variety of dermal lesions. You have the infundibular keratinizing acanthoma of the dog. You have keratoacanthomas, which have been described in rats. They all have some of the basic similar characteristics, but they're all a little bit different and very species specific. Slide number 7 is tissue from a mouse. Can you give me a morphologic diagnosis and a likely cause? Okay, time's up. This is a tough one. We are up close and personal. This is a fixed specimen, but it's a beautiful picture. And this is lung, okay? We have normal lung here, and then we have these large areas of solidified, formalin fixed pus. These all represent airways, okay? The morphologic diagnosis I'm looking for here is multifocal to coalescing suppurative bronchopneumonia with bronchiectasis. And that with bronchiectasis is extremely important, not only to your morphologic diagnosis, because I can't give you full credit without it, but also to the likely diagnosis, okay? In mice and rats, Mycoplasma pulmonis has been a very prominent historical disease that has caused pneumonia. And we don't see it anymore in laboratory animals. It's been taken out. If you want to see Mycoplasma pneumonia, we had a very nice case in the Wednesday slide conference this past year. And you can still see this and a lot of other historic diseases of mice and rats. If you go to Petco or PetSmart or whatever, and you get yourself a couple of mice or a couple of rats, and you sack them, and you'll see this. But in laboratory rats, it's almost unheard of now. The interesting part about the case this year in the Wednesday slide conference, which I continue to shake my head over, was that this was a case that was being used as a research animal in a fairly prominent research facility. And the researcher decided that, why does he need fancy mice for his research? He could just go down to the local pet store and get them. And he ended up with a bunch of animals with these great classic diseases. Okay, let's get back to Mycoplasma pulmonis. It's a cause of chronic progressive pneumonia or chronic mycoplasmal pneumonia in mice and rats over the years. One of the keys to the diagnosis of mycoplasma in any species is the presence of bronchiectasis. Mycoplasma has a particular tropism because of all of the genes that it shed to live attached to ciliated cells. One of the genes that is conserved in mycoplasma is a gene which allows it to bind to cilia and live there. And so you tend to find mycoplasma infections in organs with cilia. This will be the airway, the inner ear, some parts of the reproductive tract. Okay, you can also find them in other places, such as the joints. But when it's in the lung, it's always in the airways, and mycoplasma are cell wall deficient bacteria that live down in the cilia. Because of that, they damage the cilia, they result in ciliostasis, a deficiency in the mucociliary escalator, and an infection that concentrates on the airways. Mycoplasma, for something that is stripped down in terms of genetics, and certain types of mycoplasma have the smallest genome of any known living organism. They do a couple things. One of the first things is they cause intense recruitment of neutrophils. When you bring all these neutrophils into the airways, they tend to get together, they party, they form pus, but that dissolves the elastin lining that gives the airway its shape. And when you do that, the airway becomes a big, loose bag of pus. And there's no potential for this ever to clear because there's no mucociliary escalator. It's just a big gravity-laden bag of pus. Doesn't matter whether you're looking at a mouse or an ox with Mycoplasma bovis. They all have these big dilated bronchi, which we call bronchiectasis. Second thing the mycoplasma will do, and something that looks very characteristic on the histologic appearances, all mycoplasma have superantigens, which cause tremendous recruitment and proliferation of neutrophils. So one of the things that you often see are tremendous cuffs of, I said neutrophils, I'm sorry, I meant lymphocytes. Tremendous cuffs of lymphocytes, tremendous lymphocytic cuffing around these inflamed airways. Sometimes it precedes it, and you get tremendous, bronchial or lymphoid cuffing and hyperplasia of bronchial or associated lymphoid tissue. Sometimes it's after you get the pus. Nothing else looks like this. It's a great lesion. Just remember, mice and rats, Mycoplasma pulmonis. Sticking with the lung, here's a fantastic picture. One of my favorites of all time. And this is tissue from a dog. Can you give me, let's name the disease. We'll start there. Okay, time's up. The disease is uremic pneumonitis. Okay, morphologic diagnosis would be diffuse alveolar septal and vascular mineralization. This is probably the worst side effect of chronic renal failure. When this happens with any appreciable area, that's pretty much it for the animal. Remember that when you have failing kidneys, you have alterations in the concentrations of calcium and phosphorus in the blood. Generally, when the kidneys fail, they have a deficient mass to excrete phosphorus appropriately. The phosphorus levels begin to rise. Initially, the body will compensate by decreasing the calcium levels, but eventually, over time, the calcium level is going to sneak back up because they can't get rid of the calcium either. And when the calcium level multiplied by the phosphorus level hits 70 or above, you're going to start getting deposition of mineral throughout the body. You can see it in places like the muscles of the intercostal muscles underneath the pleura. That's not, it's a pretty lesion, but it's not really going to kill a lot of animals. You can see it, and you will see it first in the kidney, in that failing kidney. It's not going to kill a lot of animals. You will see it in the mid-stripe of the gastric mucosa. Not going to kill a lot of animals. But when you get it in the lung, okay, when you have mineral deposition along the alveolar septa, you can't pass any oxygen through that. So anywhere there is mineral, that's dead lung. You're never going to mobilize it. It's gone forever. It tends to be associated with a lot of edema, which takes out more surrounding lung. If you were to feel this particular piece of lung, it would feel like a pumice stone. If your mom ever used a piece of pumice stone which is like lava rock to smoothen her feet. Or if you've ever put these in your barbecue, your propane tank, is like lava rock. This would be very fine. If you crushed it, it would sort of crinkle up. It's a tough slide to look at the first time and get it right. But if you've seen enough of these, and this is about as good as it gets, you'll start to recognize the effects of uremic pneumonitis. So this is the end stage of chronic renal failure. You don't really come back from this. Slide number 9 is tissue from a snake. Can you give me a morphologic diagnosis, name the condition, and 2 possible causes? Okay, time's up. This is a classic lesion of snakes. Those of you who've never been bit by a snake, they're little tiny teeth. Their teeth are tiny, but they're so incredibly razor sharp. When they bite you, you don't even hardly feel it. And then you get their mouth off of you, and you're bleeding like a stuck pig. Because they're sharp, but you don't feel getting bitten. And this is one I wouldn't want to get bitten by. See his problems to start with. And this is a condition in which the name of the disease and the morphologic diagnosis are very similar. This is multifocal coalescing necrotizing stomatitis. The name of the condition is necrotic stomatitis. A lot of people will call this mouth rot. And it's associated with poor husbandry. Obviously, this animal may not be fed very well. And the bacteria that are most commonly isolated from this are gram-negative bacteria. Aeromonas, Hydrophilus, Pseudomonas would be 2 very good choices. There are going to be a lot of other gram-negatives here. Snakes have a very delicate relationship between gram-positives and gram-negatives. Gram-negative overgrowth in snakes tend to be pretty bad, whether it's in the mouth here or whether it's in the gut, like salmonella. Having raised snakes in my youth, very important to get them to eat on a regular basis. Like I say, the snake doesn't have to eat, but the salmonella is going to eat. And so you see cases of salmonellosis in snakes that haven't eaten well or have been neglected or just decided for, maybe they have concurrent diseases like cryptosporidiosis to prevent them from eating. But that salmonella is going to eat. So salmonella, they live in their gut. Doesn't take a whole lot of disruption to cause significant and fatal enteric disease. So gram-negatives in snakes can do a whole lot of damage. Okay, our last slide for today is tissue from a horse. Can you give me a morphologic diagnosis and a cause? And give me the name of this disease. I got 2 cats fighting over here. Smeeks is not happy. She does not want to come down. Finn's been getting better, though. He's not as unmerciful with her as he was. Okay, well, that gave you plenty of time to look at this. We're looking at the south end of a mare. We are looking at the vulva, and we can see that there are multifocal areas of ulceration. Some look like they're pretty much healed. Some still look a little bit open. This is multifocal to coalescing. Ulcerative, you could call it pustular as well, vulvovaginitis. This is a disease that is known as equine coital exanthema. It is caused by equine herpes virus 3. It is a disease that generally doesn't cause tremendous problems. Many alpha herpes viruses in the natural host cause lesions of the oral cavity and the genitals. This is a disease that's fairly well restricted to the genitals of horses. I'm not familiar with it affecting the oral cavity. It is usually spread by the stallion, who may have fairly inapparent ulcers or plaques along the shaft of the penis, and he breeds the mare, and the mare develops a lesion that is a little bit more severe, more clinically obvious. Remember that it's an alpha herpes virus. So the stallions will have lesions for 3 to 4 weeks. They start as ulcerative lesions. They start as blisters, quickly become ulcerated lesions, then they become flat yellowish plaques, and then they disappear. And for the most part, you never see them again. So these animals are infected for 3 to 4 weeks. Same thing pretty much happens with the mare. There have been reports of recrudescence in mares. There has been one report of transmission to a foal by passage of the birth canal. Obviously, parturition and pregnancy are a time of stress, so you could have an animal that would have a stress relapse or recrudescence of the infection. It's not a hugely damaging disease. So as alpha herpes viruses go, it's a pretty mild disease in the horse. Okay, well that brings us to the end of Growth Path Challenge number 72. I hope you enjoyed the lecture as much as I enjoyed giving it. I hope you learned 1 or 2 little things that you might have known before, and you find the half hour you spend with me every day a worthwhile experience. It's Sunday tomorrow. I think we're going to have time for another one. I try to balance these with some of the other things that we are populating the Foundation Facebook channel with, including our Free Friday seminars. Our next seminar, very much looking forward to Dr. Carlos Rodriguez talking about his experience as a zoo pathologist. He's one of the pathologists now at Disney's Animal Kingdom. I know he's going to have some great diseases to talk about. That will be next Friday, the 8th at noontime. And then don't forget, every Wednesday, or at least this coming Wednesday, will be the last publication of the Wednesday slide conference results, because we have 25 conferences at JPC every year. And so this is conference 25. It's bone and muscle conference. I know you won't want to miss that. And then starting on the 12th, the foundation will be having full day seminars. And you can get race credits for these seminars. It'll be every other Tuesday. So we're trying to get a lot of stuff out there while we're all cooped up and have a little time on our hands. So once again, thanks so much. I hope that everybody stays indoors, stays safe, and we all make it through this thing together. Have a good day, y'all.